Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is Dr. Lynn Simon, President, Clinical Operations, and Chief Medical Officer, Community Health Systems. Lynn, welcome. Thank you for joining us.
Thank you so much. It's great to be here.
Community Health Systems is one of the country's 4 publicly traded general acute care hospitals. You own, operate, and lease about 80 hospitals in 16 states. Tell us about the scope and scale of CHS.
Well, we like to think of ourselves in about 47 distinct markets. So we have one or more hospitals in each of those markets, and then we have over 1,000 sites of care altogether collectively. So within each market, we may have ASCs or urgent care centers, certainly physician practices, imaging centers, et cetera. So it's really about having a variety of access points, both on the inpatient side and outpatient.
What's unique and challenging about your patient population and the geographies you serve?
So each of those 47 markets has their own geography and their own demographics. So we're everywhere from Key West, Florida to Alaska and lots of places in between. They each have their own competitive landscape, physician relationships, et cetera. So, the challenges or opportunities are really different. Healthcare is local.
And what does that mean in terms of operations, economics?
So from my standpoint, my role, I really think about what kind of infrastructure do each of those 47 markets need to have. And so it's really sort of our role to think about that. And what really do we include is table stakes. What does everyone need to be doing? Because it's just the right thing for healthcare delivery. So we think of things like centralized scheduling and those types of things as just kind of table stakes, and we need to do that. And then we look at the portfolio and say, well, what's really special about a market? And what infrastructure do they need, like our transfer centers in about 65 of those 80 hospitals. So not everything is right for every market, but there's some things that we know is there's just the right infrastructure for all healthcare systems.
You use this word table stakes. I think table stakes in healthcare seems to be being punched in the gut continuously. Continuous headwinds, recessionary environment, inflation, patient volume mixed across publicly traded hospitals. Inpatient admissions were down almost 2% last year. Outpatient and ambulatory surgery center volumes grew about 3%, depressed to negative margins. Over the past year, CHS stock has been pulled down almost 70% to roughly $4.50. What are the challenges driving CHS performance, and how are you navigating to growth?
So we are really strongly focused on accelerating growth. That's one of our near-term priorities. So to do that, really focused on strengthening our workforce, freeing up capacity, and taking those things and using some of our centralized resources like our transfer center to really drive the volume. So we know there is capacity. I mean, there's desire for our healthcare systems. And so we have to open up that capacity, both with the people resources, and our efficiency resources. And then we know that there is demand in our market, and we can capture that demand. And one other thing we're focused on is really care coordination and what we call network integrity. So when a patient uses our services and they need other healthcare services, how do we navigate them to keep that care in our networks?
What do you mean by that?
Well, we like to, certainly people talk about navigation and care coordination. And so typically when a patient enters the healthcare system, a lot of the needs, particularly in patients with chronic conditions, it's sort of not a one and done thing. So if they're seeing a primary care specialist within our network and they need specialty care, we'd like to navigate them or help them make sure they get that next appointment within our system if we offer that service.
A lot of health systems talk about this. Any other ingredients, whether it's the ingredients or engagement model, operating model, where you all are trying to differentiate?
Well, we are really focused on making sure that if patients have received a referral for care, that we complete that. We know that in the literature, about 50% of the time that happens. So your doctor tells you to go see a specialist. I'm a neurologist. So if they tell you to see a neurologist, shockingly, that only happens about 50% of the time that patient actually gets there. So what we've done is put resources, in our markets to make sure that we can close that gap and get that care provided. And we've been able to increase that from about 50% to over 80% of the time.
Some of these elements that you're talking about, involve cost, and CHS has been working on margin improvement for the past 3 years, and it'll take another couple years for you to hit your target. Is this like being in quicksand? How will you get there?
Yeah, I don't know that it's being in quicksand, but it is something that I think is, we don't think is going to end. It's going to be a continual process, and we continue to iterate. So, for example, when we work on supply chain initiatives, the clinical operations team works with our supply chain team. We have people boots on the ground working to tell us, what commodity items can we provide at the lowest cost that are the highest value, and even physician preference items. What can we use and standardize across the organization to really help lower costs? So we've done some significant things like that, but everyone is involved in those activities, and we're continually thinking of how we can lower our cost structure.
So Lynn, how then do you balance running the business versus investing in innovation and changing the business?
So I don't really like to think of it as the or and have to make the decisions. I really think of it as the and. So really using innovation to drive our business imperatives. So when I think of, sort of how we do that, we're very tight on how we look at our ROI or how we look at the value of any investment like that. So we're very pragmatic. So if we have a solution, we have to tie it directly to a clinical or business outcome. And so that really innovation really drives our business imperatives.
Any examples that you can share where you're innovating at scale and the outcomes? Because, it seems like the reality on the front line is delivering care seems to be changing little. The patient seems lost and confused. So give us an example of some of the innovations that you're pursuing at scale and the outcomes, how it's actually impacting these stakeholders.
So I'll give you 2 examples. One is telesitting. So we're really working on virtual nursing. So how do we have virtual nurses become part of the care team, support the care team, and support the patient? So with virtual sitters, we've been able to reduce our reliance on people in the room sitting and actually leverage that by scale. And we've seen reduction in falls and actually reduction in sitter cost. I'll call out remote patient monitoring, which I think we're just getting to scale. We have 1,100 patients enrolled currently being monitored, and we'll have that fully scaled across our primary care portfolio, hopefully with closer to 10,000 patients through the course of this year. But we've been able to reduce or improve hypertension, diabetes, congestive heart failure. It really reduces the workload on our clinics, so the providers love it. The clinic staff is not burdened by taking care of all these patients. Actually, our partner Cadence takes on that responsibility. And then actually we've been able to implement that in a sustainable financial model. So it's kind of the trifecta. The patients love it and are doing better clinically. The doctors aren't overwhelmed with additional workflow, and they find it easy to use. And then financially for the organization, it's a sustainable model.
Lynn, finally on leadership. In career and business, there are many rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
Well, I don't know that we totally broke the code, but I think we're starting to find out what works in our organization. So in my day-to-day role with clinical operations and also innovation, I've really found that since the organization values innovation and we're at scale, we can really take an idea because of the integration of the business and innovation, that we can take an idea to a solution, to an evaluation, to a socialization, to implementation, and then scale and drive large-scale change across the organization, again, tied back to the strong value equation for our business.
Lynn, thank you so much for joining us.
Thank you. It's been great to be here.